Intestines are commonly seen dorsal to the spleen. If so, it is a good time to press the freeze button, use cinematic loop to select the best image, and get a measurement of the intestinal wall. The measurement gives your eye something to compare to as you see other intestines. If you do not see an intestine to measure near the spleen, you will find some later in the exam as you move the ultrasound beam from the left adrenal to the urinary bladder, or from the urinary bladder to the right kidney. Intestines are evaluated for thickness, wall layers, and motility. There are tables of normal intestinal thickness for dogs and cats. Intestines have the same 4 wall layers as the stomach, but there is a difference in the relative thickness of the layers. In intestines, the mucous membrane layer appears relatively thicker than in the stomach. The submucosa and muscularis seem thinner than in the stomach. If the patient has not been fed in 12 hours, the intestines are expected to be empty. Intestines usually contract 1 to 3 times per minute, and the peristaltic motion should be in one direction. You should not see abdominal effusion or mesenteric lymph nodes. In dogs and cats, the duodenum is usually seen by following the stomach and then pylorus to the duodenum. The descending duodenum can be found by placing the transducer in a transverse position over the right cranial abdomen and pressing into the abdomen till the right kidney is seen. As you release pressure, the duodenum appears ventral or medial to the right kidney. Remember, the right limb of the pancreas is medial to the duodenum. In dogs, the duodenum is larger than the other intestines. In cats, the normal ileum is often seen in the right caudal abdomen. The feline ileum has a prominent submucosa. The ileum can be followed into the ascending colon. In cats, the ileum is larger than other intestines. Gas artifact is commonly seen in the intestines. When present, it often obscures your view of other structures. Like the stomach, the intestines have 4 wall layers: an inner hypoechoic mucous membrane layer, a hyperechoic submucosa, a hypoechoic muscularis layer, and an outer hyperechoic serosal layer. Remember, you are measuring one wall of the intestine, not the diameter of the entire intestine. Press caliper or measure and place one caliper at the interface of the hyperechoic lumen of the intestine and the hypoechoic mucous membrane layer. Place the other caliper at the outer surface of the serosal layer. Label this image intestine and save the image to the patient record or archives.